Okay, so the first goal mentioned here is eradicating no poverty. So I'm going to read this one really quickly. Extreme poverty, defined as surviving as less than $2.15 per person per day at 2017 purchasing power parity, has witnessed remarkable declines over the recent decades. However, the emergence of COVID-19 marked a turning point, reversing these gains as the number of individuals living in extreme poverty increased for the first time in a generation by almost 90 million over previous predictions. Even prior to the pandemic, the momentum of poverty reduction was slowing down. By the year of 2022, nowcasting suggested that 8.4% of the world's population, or as many as 670 million, could still be living in extreme poverty. This setback effectively erased approximately 3 years of progress in poverty alleviation. If current poverty patterns persist, an estimated 7% of the global population, approximately 575 million people, could still find themselves trapped in extreme poverty by 2030, with a significant concentration in sub-Saharan Africa. A shocking revelation is the resurgence of hunger levels, those last observed in 2005. Equally concerning is the persistent increase in food prices across a larger number of countries compared to the period from 2015 to 2019. This dual change of poverty and food security poses a critical global concern. All right, why is there so much poverty? Poverty has many dimensions, but its causes include unemployment, social exclusion, high vulnerability of certain populations to disasters, diseases, and other phenomena which prevent them from being productive. Why should I care about other people's economic situation? There are many reasons, but in short, because as human beings, our well-being is linked to each other. Growing inequality is detrimental to economic growth and undermines social cohesion, increasing political and social tensions, and in some circumstances, driving instability and conflicts. Generational knowledge is shared, and no. Okay, why is social protection so important? Strong social protection systems are essential for mitigating the effects of preventing the many people from falling into poverty. The COVID-19 pandemic had both immediate and long-term economic consequences for people across the globe, and despite the expansion of social protection during COVID-19 crisis, 55% of the world population, approximately 4 billion people, are entirely unprotected. In response to the cost of living crisis, 105 countries and territories announced almost 350 social protection measures between February 2022 and February 2023. Yet 80% of these were short-term in nature, and to achieve the goals, countries will need to implement nationally appropriate, universal and sustainable protection systems for all. What can I do about it? Your active engagement in policy making can make a difference in addressing poverty, ensures that with your right are promoted, and that your voice is heard, the voice is heard, that intergenerational knowledge is shared, and that innovation and critical thinking are encouraged at all ages to support transformational change in people's lives and communities. Governments can also help enabling environment help creating an enabling environment to create pro-productive employment and job opportunities for the poor and the marginalized. The private sector has a major role to play, determining whether the growth it creates is inclusive and contributes to poverty reduction. It could contribute economic opportunities for the poor. The contribution of science to the end poverty has been significant. For example, it is able to access safe drinking water, reduce deaths caused by waterborne diseases, and improve hygiene to reduce health risks related to unsafe drinking water and lack of sanitation. The next goal, this one is called Zero Hunger. All right, this one's about hunger. So, achieving food security and ending world hunger is essential for a sustainable future. Goal 2 focuses on ensuring everyone has access to safe, nutritious food while promoting sustainable agricultural practices. Goal 2 is about creating a world free of hunger by 2030. The global issue of hunger and food insecurity has shown an alarming increase since 2015, a trend exacerbated by a combination of factors, including the pandemic, conflict, climate change, and deepening inequalities. By 2023, nearly 1 in 11 people worldwide face hunger, while more than 2 billion experience moderate to severe food insecurity. Global hunger levels, measured by the prevalence of undernourishment, remained at the same level for 3 consecutive years after a sharp rise during the pandemic. This data underscores the severity of the situation, revealing a growing crisis. In addition, an estimated 2.33 billion people face moderate to severe food insecurity in 2023. This classification signifies the lack of access to sufficient nourishment. The number escalated by an alarming 383 million people compared to 2019. The persistent surge in hunger and food insecurity, fueled by a complex interplay of factors, demands immediate attention and coordinated global efforts to alleviate the critical humanitarian challenge. Extreme hunger and malnutrition remains a barrier to sustainable development and creates a trap from which most people cannot easily escape. Hunger and malnutrition means less productive individuals who are more prone to disease and thus often unable to earn more and improve their livelihoods. 2 billion people in the world do not have access to safe, nutritious, and sufficient food. In 2024, 23.2% of children have stunted growth, and 6.6% of children under the age of 5 were affected by wasting. How many people go hungry? It is projected that more than 600 million people worldwide will be facing hunger in 2030, highlighting the immense challenge of achieving the zero hunger target. People experiencing moderate food insecurity are typically unable to eat a healthy, balanced diet on a regular basis because of income or other resource constraints. Why are there so many hungry people? Shockingly, the world is back at hunger levels not seen since 2005, and food prices remain higher in more countries than in the period between 2015 and 2019. Along with conflict, climate shocks, and rising cost of living, civil insecurity and declining food production have all contributed to food scarcity and high food prices. Investment in the agricultural sector is critical for reducing hunger and improving food security, creating employment, and building resistance to disaster and shocks. Why should I care? We all want our families to have enough food to eat when what is safe and nutritious. A world with zero hunger can positively impact our economies, health, education, equality, and social development. It's a key piece of building a better future for everyone. Additionally, with hunger limiting human development, we will not be able to achieve the other sustainable development goals such as education, health, and gender equality. How can we achieve zero hunger? Food security requires a multidimensional approach, from social protection to safeguard nutrition, to social protection to safeguard safe and nutritious foods, especially for children, to transform food systems to achieve a more inclusive and sustainable world. There will need to be investments in rural, urban, and in social protection so poor people have access to food and can improve their livelihoods. What can we do to help? You can make changes in your own life, at home, at work, and in the community by supporting local farmers or markets that are making sustainable food choices, supporting good nutrition for all, and fighting food waste. You can also use your power as a consumer and voter, demanding businessmen and governments make the choices and changes that will make zero hunger a reality. Join the conversation, whether on social media platforms or in your local communities. And the final goal, this one is a good health and well-being. Great strides have been made in improving people's health in the recent years. 146 out of 200 countries or areas have already met or are on track to meet the SDG target on under 5 mortality. Effective HIV treatment has cut global AIDS-related deaths by 52% since 2010, and at least one neglected tropical disease has been eliminated in 47 countries. However, the inequalities in healthcare access still persist. The COVID-19 pandemic and the other ongoing crises have impeded progress toward Goal 3. Childhood vaccinations have experienced the largest decline in 3 decades, and tuberculosis and malaria deaths have increased compared to pre-pandemic levels. The Sustainable Development Goals make a bold commitment to end the epidemics of AIDS, tuberculosis, malaria, and other communicable diseases by 2030. The aim is to achieve universal health coverage and provide access to safe and affordable medicines and vaccines for all. To overcome these setbacks and address long-standing healthcare shortcomings, increased investment in health systems is needed to support countries in their health, in the recovery, and build resilience against future health threats. Access to essential health services. A significant portion of the global population still lacks access to vital healthcare services. To bridge this gap and ensure equitable healthcare provision, addressing disparities is critical. Various determinants of health, including environmental and commercial factors, need attention to pave the way for achieving our common objectives for health for all and achieving the Sustainable Development Goal targets. How can we achieve these targets? Ensuring healthy lives for all requires a strong commitment, but the benefits outweigh the cost. Healthy people are the foundation for healthy economies. Countries worldwide are urged to take immediate action and decisive actions to take immediate and decisive actions to protect and counteract health challenges. What is Goal 3? Good health and well-being. This becomes especially critical in safeguarding vulnerable population groups and individuals residing in regions burdened by high disease prevalence. By doing so, we can strengthen health systems and foster resilience in the face of health adversities. Immunization is one of the world's most successful and cost-effective health interventions. However, the alarming decline in childhood vaccinations, the largest sustained decline in childhood vaccinations in approximately 30 years, is leaving millions of children at risk from devastating but preventable diseases. Does everyone have access to universal healthcare? Universal healthcare coverage aims to ensure that everyone can access quality health service without facing financial hardship. While efforts to combat infectious diseases like HIV, tuberculosis, and malaria led to insignificant expansions in service coverage between 2000 and 2015, progress has been slowed. Inequalities continue to be a fundamental challenge for UHC. Coverage of reproductive, maternal, child, and adolescent health services tend to be higher among those who are richer, more educated, and live in urban areas, especially in low-income countries. What can I do to help? You can start by promoting and protecting your own health and the health of those around you, by making well-informed choices, practicing safe sex, and vaccinating your children. You can raise awareness in your community about the importance of good health, healthy lifestyles, as well as people's right to quality healthcare services, especially for the most vulnerable, such as women and children. You can also hold your government, local leaders, and other decision makers accountable for their commitments to improve access to health and healthcare.